everyone! We are going to do a live chat with Dr. Daigle. Let me find him. Da, da, da. He's coming. John, say hi to everyone. Get your trumpet out. Hey, hey!
Hey guys.
Watch this. John's about to play for you. Ready? You got it, babe. It's okay.
You need to come to New Orleans. I know, that's so awesome.
He's so amazing. I don't even, you know, it's funny because I am not musically talented whatsoever. Like none. What side of the brain is that?
John. Right. You need to get John to, John, you play the saxophone, man. That's my favorite instrument.
Can you play a saxophone? Tell me
The saxophone.
It's Steve.
Yeah?
Yeah.
You can't
look
see
good,
us, can you?
Yeah, I can see you guys. Can you see me?
Yeah, we see you. Here we are. Did you have a Merry Christmas?
You had a good Christmas? I did.
We just
My little princess was so excited.
Oh my, I bet you spoiled her.
Oh yeah.
Oh
Although
yeah.
the worst part is when you get, so in kids, so when you get these, my daughter wanted a slide. So I don't read instructions at all. And, you know, you get a slide and it says, you know, 3 to 4 people taking 10 to 12 hours. That's never good for someone like me. So, yeah, trying to screw stuff into plastic and you don't read instructions. The pictures, you know, don't really look what it really turns out to look like.
Oh my
but
gosh.
She enjoys her slide.
Did it break when she got on it?
No, she made it successful, but I'm like, please God, you know.
Yeah, let's do
good.
that. Oh my gosh. So how was your day of work today?
It was good. It was real good. You know, just lots of patients back in. You know, I was just getting called up.
What do you say?
Navy.
Navy, you're Navy. Yeah. Doesn't he look so good without his glasses on?
He does. He looks real good. John, you look real good, buddy. I know.
You feel
so
strong?
Did Notre Dame make it into a bowl at all?
I don't know. But they did send him a Christmas present. And I asked him yesterday, I said, what was your favorite present? He said, Notre Dame. I was like, great. Forget about everything I gave you.
Yep.
Oh my gosh. You crazy, babe. You're crazy. Oh my gosh. Okay, so topic tonight, we're talking anger, agitation, any of these things that people are kind of, you know, like, what did I post the other night about how we like surpassed it? The agitation, and people were like, well, you know, they're kind of stuck in that and had been stuck in it for a really long time. I think that we can like kind of address tonight. I'll talk about the caregiver side of like the environment, and you talk about the tools that you gave us to help fight through that. Because I think a lot of it was the tools that you gave us for his brain to kind of even, and I think that not even just with the brain injury, but anyone that has them, you know, emotional challenge or behavioral challenge, it's just an imbalance, really.
Yeah, well, a lot of people too, you know, a lot of people don't realize, but, you know, the same way that we work with a brain injury patient is the same we work with, you know, a kid who's got developmental issues. For example, you can get like a kid who has ADHD and parents are complaining because his kid's super smart, but yet he has these, you know, crazy impulsing that, you know, the mom, he's throwing these tantrums. They take his iPad away, and then, you know, for weeks he's mad. And, you know, there's a reason why that these kids have that. And when you look at a brain injury, you look at an adult, and, you know, depending on what parts of the brain may have been damaged or injured, then you also have to look and say, all right, well, you know, what is the history of this, you know, adult? Or even this could be a geriatric patient. You know, I've seen some people literally have a stroke. They could have been the nicest person in the world, and all of a sudden, you know, now they have a stroke in the right side of the brain, and then, you know, their left brain takes off, and that's what they were, you know, dominant. And now these people are like super agitated. So if you want to just talk about some of the caregiving stuff, like, you know, how you cope with it, and then I'll just on the back end talk about the neuro.
Yeah, I think a big key thing as a caregiver, and I think just anyone, when you have somebody that has any kind of traumatic injury, or, you know, in these, you're having these behavioral things come through, number one, the biggest thing is the environment you put that person in. And if you're putting them in an environment that's stressing them out when their brain's already stressed out or anything, you're just causing more fire, or whatever. What would you say? Smoke to the fire, or whatever.
Yeah, just throwing gas to the, you know, adding gas.
That's the word. See, I don't even know these analogies. But so environment, you know, when John finally felt safe, safety is number one. When they feel like that they're being heard, I think, is another thing. A lot of times I feel like sometimes maybe lack of communication, or, you know, they're not being heard, or they're not able to express what's really going on. And if they're constantly in that stress, like the fight or flight stress, that's just going to cause more agitation. And it might not come across like they might not be able to show what they're trying to say, but it's going to be ongoing agitation, right? So I think that as a caregiver, the best thing you can do is make them feel safe and give them the environment to heal, really. And then also, you know, limit any outside stressors, like the environment, as far as toxins or anything that's going to throw their system off, because they're just so fragile and they're trying to heal. And yeah, I think that's,
or just even like people talking, you know, even like, you know,
absolutely.
the whole thing about, you know, I was really neat. So I was at a board meeting with my software company, and one of my business partners was he was telling me about the water experiment. And I don't know if you've heard of it. I think we talked about this before, but they took like this water sample, and they've, you know, they've played like, you know, like evil music or crazy music and stuff, or like said like, you know, hateful words, and under a microscope that literally the water actually literally changed structures. And that's something too, is that when someone has a brain injury, you know, the biggest thing from a caregiver standpoint is really there's no guideline, or there's no book that's going to tell you exactly what to do. So you're literally depending on doctors for answers, because your life just basically gets completely turned upside down. And so then from that, it's like, all right, well, you know, now you have all this, you know, your life's flipped upside down. So now natural instinct is fear.
Right.
And then if you don't see immediate progress, then people start really getting depressed. And then when you start getting depressed, then you start losing hope. And then when you start losing hope, if you don't have any type of consistency, or you don't have a great rehab team, you know, even if you know, from a spiritual standpoint, if that's not there, you know, it's really hard to recover. And you know, again, that's with anything.
Right.
So I'm really big, just like we start talking about, you know, like there's actually, you know, binaural beats people have used, like a thing called 528 hertz, or just listening to like whole tones.
Yes.
You know, and that's a really cool, you know, frequency. And again, there's people out there that, you know, and again, this isn't from a religious standpoint, is just that, you know, they're showing scientific evidence that, you know, even using certain frequencies can do different things. For example, your brain, you have different brain waves, and those brain waves actually oscillate at certain frequencies. That's what differentiates what wave that they're in. Certain sounds, for example, like, you know, if I shoot a gun right now, people jump, but then you go get a massage and the lady's got like an Indian flute or some sort of like waterfall, and that frequency, that sound is very therapeutic. It's very relaxing. And, you know, what I see when I work with brain injuries is, you know, from a neurological perspective, there's a lot. One, if you walk up behind them, you see them kind of jump a little bit like that. So you have a startle reflex. Okay, anything. I mean, you can literally just take your arms and move your arms like this, and you see someone jump. So that's a reflex that, you know, shouldn't be there, but with the injury, this reflex come out. So it's kind of like babies. You grab a baby and you pick a baby and you kind of move them like that. What do they do with their arms? They throw their arms out.
Right.
So you see this is that now as an adult, you know, or even a kid, you know, an anger issue, someone needs to check for retained primitive reflexes. And again, so what happens is when the brain has like an injury, so here's my brain here, and then I have an injury. So it's kind of weird to do this. So my brain basically hits the frontal lobe, and then it goes back, and then it hits it again, or it can you can have a torsional or a diffused axonal injury. It literally disrupts. So the front side of the brain can't go down to an area called the brainstem and actually inhibit it. And so if it can't, you get a frontal release sign, which is a primitive reflex. So like you showed John, like the rooting reflex, where his lips, his lips can actually move. And if you have these reflexes, that's telling you that the front side of the brain can't come down and inhibit things. Mm-hmm. So now what can that translate into? One, you can get behavior issues, you can get mood issues, you can get impulsiveness. And then it goes back and said, all right, well, if the right side of the brain, which is like your brake and it tries to calm things down, if it can't engage to suppress things, well, then now you can get really impulsive. You can literally give someone a glass of water and they could just throw it. Or you can put something on a table and they can just knock it over. And it's just because the right side of the brain's just not able to come down and inhibit certain movements. Or you might start seeing people start getting weird involuntary movements where they can't stop themselves. Right. And again, it's because the right side of the brain can't come down and suppress things. I tell people all the time, and this is, and it's not I go to a birthday party with my wife. We bring, my little kid. I have a young little daughter, and again, I'm not making fun of any kid, but what I can do is when I go into a party, I always look around at kids. And what I look for is I look at their eyes, and I look to see if everyone's eyes are straight. And what I'll see is I'll get some kid will have like this deviation in his eye. It's called a strabismus. And a lot of times whenever I work with patients who have behavior issues, for example, it's like this autistic kid that comes in and the mom's like complaining that, my kid, he's just got really bad impulsiveness, or this kid with ADHD, or someone with bipolar, or even I've seen even adults where I've seen the CEO of a really large company where he's got a deviation in his eye. And he's, this guy's super driven, but yet he's like, dude, I flip out whenever things don't go. I'll start throwing stuff, start yelling. And I'm looking at his eyes and I'm like, man, horizontal eye movements actually fire into a part of the brain called the pons, which is where serotonin is produced. Okay. Right. So serotonin is the chemical that does like mood and relaxation. So if you have some sort of ocular deviation, your eyes can't move like they should, especially horizontal, that can have an impact on your mood and your regulation. So in the military, they've done stuff where they've done EDMR therapy, where they literally had patients do a bunch of eye movements to try to help disassociate certain traumatic events that they've been under. And it's just pretty cool stuff, because it's like you can literally, there's lots of therapeutic stuff. One, we mentioned sound. Music can do certain things. Literally putting music just in the left ear to stimulate the right brain can have an impact. Horizontal eye movements, getting rid of primitive reflexes. How do you do that? Well, you can stimulate the reflex. You can do, Dr. Melillo has a book called Disconnected Kids. There's these guys right here. Shed Light has a phenomenal laser that you can laser.
That was our go-to for a while.
Certain aspects of the brain. And another big thing is there's an area right here behind the ear. It's called the cerebellum. And the cerebellum, there's different lobes of it, but the middle of it deals with
there you are.
The midline cerebellum, which deals with like your core. So you think about these patients who have, traumatic brain injuries, and even some of these kids who have, ADHD or autism or some sort of developmental issue that have poor core. That's actually a huge thing. So the stronger that your core gets, the stronger that the midline part of the cerebellum gets, which has a bigger impact on control and emotion. Mm-hmm. And it's things like this, and it's like, wow, like this is, it's in the literature. You can look up research. You can start looking and seeing, primitive reflexes and behavior, primitive reflexes and, frontal lobe function. You can look at horizontal eye movements and serotonin, or horizontal eye movements and mood and relaxation. And then again, look at the cerebellum, the midline, and then look at its ability to regulate mood. So it's like, wow, you can do eye movements to help people out. You can get rid of primitive reflexes that can help people out. You can do core stability that's going to help people out. And so it's also, too, the more that people run and you exercise and you move, midline structures helps the brain out. And it's always this, the better that your brain's function and the better that you can start to control things. And the more integrated your brain is, now you actually, you can start, like you guys, you guys can go to a restaurant now without, having some sort of crazy startle reflex or just getting, really upset.
Throwing them all. Right.
Yeah.
I mean, I think that, those that are saying, I think the hope and the awareness that we need to bring to people are there are providers and there are exercises to reestablish the balance in the brain. Because I think a lot of times, I've had many reach out to me and say, I've heard that my loved one's going to have a personality change for the rest of their life. They're going to have depression. They're going to have this. They're going to, they're going to be angry. They're going to have outbursts. They're going to, just like with John, I was told we were just going to have to find a way to cope with his agitation, right? But I think what people need to know is if you're stimulating the brain correctly, you can actually integrate and retrain the brain to actually not have that imbalance.
Yeah, a lot of people don't understand that. And again, it's across the board. I've seen this stuff with, certain doctors that, I'm fortunate enough to where I get to see a lot of different cases. I see young pediatric cases. I see patients, brain injuries, people who've had, some sort of traumatic event, emotional stuff that happened, to autoimmune diseases. And again, you look at people from a developmental standpoint and say, all right, did someone miss milestones? Does someone have literally diet has a huge impact too? And again, people are like, there's no way in heck. And it's like, hold on a second. Medication and food go to the same exact place. They're both absorbed. They're both brought into the bloodstream. And again, I'm not knocking meds at all. But it's just people don't realize. Like I had a kid today that came in here and, the Christmas holidays and any type of really holiday birthday parties are really challenging if people eat foods they're not supposed to and they can't detoxify and flush them out. Right. So like this little kid comes in today and, he's like all over the place. He's crying. The mom's like, yeah, he ate bad for Christmas. He ate a bunch of sugar cookies. And again, the kid has issues with breaking down carbs. If you break down carbs or can't break them down, that leads excess sugar. You have excess sugar, which is an excites the brain. And then you have someone who's got a super strong left brain, very linear, very fast, has a hard time with pulling the brake. Now this kid eats something he can't break down. It lights the brain up. The right side of the brain can't come down and calm things down. So then what happens is now you got this kid who's just super impulsive, running all over, and nothing's going to calm him down. So what do? It's pretty cool. So we take this little kid, and we start vibrating.
Too much.
Yeah, you start vibrating the left side of the body. We start doing figure eights with the left arm, the left leg. We start doing laser therapy, start using sound in the right ear, throw some blue color lenses on them. And then 15 minutes later, the little kid's just sitting there chilling. Yes. And it's pretty cool because it's like, wow, dude, we didn't, there was no medication involved. There was no supplement involved. It was specific sensory stimulation to a certain part of the brain that needed to be stimulated. And guess what happens? It calms the person down. John's, the same scenario is that, when we first started working, he just, you would put, a glass down, he would knock it off. And just get really, really easily irritated.
You throw things, honey.
And then what we did is we just worked on trying to do sensory input onto the left side. And so it's just like this. A lot of people question about his left hand, how it's kind of like, fixated. So the brain, it functions off of sensory stimulation. So the more that you're moving, the more that you're stimulating the brain. So if you get more stimulation on one side of the body than the other, that can create a neurological imbalance. And then if your brain can't regulate itself, well, then now you can start seeing fixations. You can start seeing involuntary movements. And it's because the brain can't suppress things. Mm-hmm. And it's kind of cool. So it's people want to know, we all have different personality characteristics because we have different parts of the brain that we use a little bit more. Some people are really great at math. Some people are really great at art. I'm a super left brain person. I'm really good at like math and science. I'm very linear, but yet I have zero artistic skills. And I have to work on my right brain a lot. But yeah, it's just about understanding of that. And that's where people, it's challenging. People are like, well, where can I find therapists like this? There's a thing out there called functional medicine where people look at the body a little bit differently, where they might run a little bit different labs. They'll start talking to you about diet and nutrition. They can start talking to you about maybe doing like vagal nerve exercises. And you can go into what's called functional neurology, which is where predominantly most people are actually chiropractic or chiropractors. But you can see some PTs involved and some OTs, but people that understand that the brain, you can stimulate the brain through doing specific exercises. And the whole goal is to just find things that aren't working and actually get them to start working through using sensory input.
Absolutely. I saw somebody comment below. They asked, is it ever too late? And I think we both know never too late, right?
Absolutely.
So, you know, I'm sure you've had cases that it's been years and years and years, you know, with John, you know, with a brain injury, you're told it's going to be 6 months to a year, and that's going to be kind of the cutoff. And that from there, it's going to be what it is for the rest of your life, or that's what really happened in the brain. But to be honest, John didn't start really healing until you came along. So, and that was over 1.5 years, almost 2 years later. So that just blows doctors away.
Yeah. Well, someone mentioned some stuff about HIPAA therapy. That's another great thing. And then I guess someone else put something about opinions don't make facts. But whoever wrote that, I just want to let you know, there's a lot of research out there. It just depends on where you look. So I research off PubMed, and PubMed is what most doctors typically look at. There's a lot of great research out there. It's just really, I just feel like people have been very kind of programmed. I don't know, and people fly over the world to come and get kind of treatment from a lot of doctors like myself and other doctors that do the similar type of treatment, and we get great results.
Yeah.
But we do things a little bit different, and yeah, you get different outcomes.
Right. Why does John whisper? Somebody asked, why does John whisper? I think we've talked about this, but I believe he whispers a lot of times because, you know, he knows what he's saying and he's not sure if it's correct. Like if he's just talking right now, but then when he's around me, he talks. That, and then we also talked about all the coordination it takes, but that's
that stuff too. And then primitive reflex is still having like the rooting reflex, you know, not having good, you know, the facial tone.
Right.
Even the same thing with having difficulty swallowing. So the nerves too, the tongue and stuff are still a little bit down. And then also too, that the cerebellum. So if you've ever seen someone who's got like Parkinson's disease and they start talking, they start getting really, really kind of, they start talking really slow. So when the brain starts to degenerate, you can start seeing that people can have like softer, you know, voices. And I'm not a speech therapist, so I typically stay away from the speech aspect. But I will say, you know, just still having, you know, a brain injury, it's kind of common to see. So the more, you know, the better his brain starts functioning, the better that the speech and stuff will get.
Yeah.
But people can also too know about like, you know, vibrating. You can vibrate the tongue, you can vibrate the cheek. Those are all, you know, things that you can do to help use sensory input to, you know, increase, you know, blood flow,
Right.
Increase flow, improve, you know, nerve function.
I think that, you know, going back to the behavioral stuff and, or just agitation or anger just after a brain injury, because it's very, very common, or anyone that's really struggling with it. Number one is, someone mentioned this, and I think it's really important coming from someone that's, you know, I believe in God and I believe in, you know, all that stuff. A lot of, you have to surrender it, you know, and trying to control it is just going to make it worse. And also the energy you put out there. And then you talked about it, the positivity. If you're going to be around your loved one and always like, oh my gosh, this sucks, or this is like, they're going to feel that energy and it's going to play into who they're going to become as well. And that anger builds up inside them. So I believe as a caregiver, doing work for yourself and taking care of yourself and having, you know, whatever you relate to, for me, it's God, and I talk and communicate there. But having that is key. So then you portray that energy to them. But also the person that's going through it, a lot of times anger, I feel like, is underlying things that haven't been resolved. So, you know, with John, someone mentioned, you know, upbringing and past experiences and stuff. Those things all playing a part to healing, as we all know.
Absolutely. People don't know, just let them know that there's a thing called ACE, adverse childhood experiences. Right. And those do have an impact. Just the same thing as retained primitive reflexes. And that's, I keep harping on this stuff because it's something that was a game changer for me. You know, my practice, and even myself, you know, I had a traumatic brain injury in 2013. And, you know, I'm doing all this stuff that, you know, in the neuro world, I teach us, you know, do all these different eye movements and doing complex movements and all this sensory stimulation, but I just felt like I was always like missing something. Like I was getting 80% of patients better, and there was still like 15, 20% that I'm like, geez, I just don't know why these people aren't getting better. I mean, like neurologically, we're doing everything we should. You know, metabolic, we're putting all these nutrients, they're eating how they should. And then coming to find out, I start, you know, checking people for retained primitive reflexes, which is something I was doing for kids, but I never thought to check people adults. And that's just something huge to do, is just to try and see if, and again, you have to really find sometimes someone might go in there and just check like 1 or 2 reflexes and be like, you know, the ATNR is not there, the Palmer's not there. But you need to go through and check everything. Check the foot, check the Babinski, check the rooting, check the startle reflex, check the spinal galant reflex, check all these reflexes. And whatever ones that you find, you have to get rid of those things, or you have to integrate them.
Right.
And that's kind of a little hidden secret, I feel like, in the neuro world when you're working with brain injury patients. Even when you're working with people with, you know, these kids who have developmental issues, a lot of times that these kids, you know, people are like, I don't understand. I've ran a CT scan. I've done an MRI. I don't know why this kid's still like he is. And more than likely, he's got some sort of, you know, brain imbalance. He probably more than likely has some sort of retained primitive reflex somewhere. So his core's probably not there. These kids can't do jumping jacks and sit-ups. And I mean, I'm saying this in kids, and the same thing is in adults, is that the brain functions off of stimulations. Look at someone in a nursing home, and you look at this one person who's like super active, and they have a stroke. They typically recover really quick because, you know, their brain and their body, their muscles have a really good feedback system. But then you have that person who got diagnosed with diabetes, who's got, you know, they can't control their blood sugar. And if you can't control your blood sugar, that creates inflammation. You have this stroke or this brain injury, and then your brain's, you know, nowhere's capable of really trying to heal itself the way it should. And their recovery time's a lot slower. And so, you know, for you guys, it's just looking at like, okay, does diet have an impact? Yes. You know, what type of food should I be eating? Run a test. You know, you can do a food allergy. You can do a food sensitivity test. Check to see what nutrients someone's missing. You can do a urinalysis. Check to see if, you know, if you miss it. And the whole goal is to just find deficiency. If you keep running labs and everything's normal, and you have problems, you know, these people aren't, you know, they're not making this stuff up. There's literally something going on. And this is where, you know, finding a functional medicine practitioner, and you can look up like, it's, you know, Institute of Functional Medicine, go find someone. Dr. Siegler's got a great group with the Living Proof Institute. Yeah. He's got a bunch of great doctors all around the U.S. to go learn from. But yeah, it's just, there's, you know, I just feel like you're never really stuck. You know, if you do the, you know, the route that everyone else does, and, you know, just kind of go home, sit and wait it out and hope for the best, you know, that's not really the best outcome in my opinion. But if you go and start checking out, you know, food, changing your, you know, nutrients, start making sure that, you know, the doctors are monitoring your meds, that you're checking, you know, reflexes and doing core work and sensory stimulation, music therapy, eye movement therapy, HIPAA therapy, vibration therapy, laser therapy, chiropractic works great. It's just, it's, you know, it's a team, it's a teamwork.
And someone asked about depression. Do you have any insight on that, of like what's going on? I mean, I bet there's so many different ways you could go about it. Maybe like,
yeah. I mean, you know, a question is, well, why is someone depressed? And you know, you start looking, you start running like, you know, blood work, you start checking their inflammation levels. More than likely, they're going to have inflammation. You start checking their B vitamin. They might have an issue breaking down. They might have an issue with methylation, meaning that they could possibly have like a MTHFR, you know, mutation or some sort of genetic portion. You know, they could have a deficiency in magnesium. And then you start looking and saying, all right, well, you know, how's their eye movements? Can they actually do horizontal eye movements? Can they do what's called saccades, where their eyes goes back and forth? And again, these are checking different parts of the brain. And then you look in the back of the mouth, and you can look and see if they have what's called palatal paresis, or if they have low vagal tone, and you could recommend maybe doing vagal nerve exercises like gargling.
that
you know,
tongue thing.
Yeah, do some pretty cool things like that. There's dietary stuff where people can start finding out they're eating certain foods that are actually creating inflammation in the brain. You know, I mean, there's a lot of stuff to do. There's laser therapy, and then even just exercise in general. You know, exercise is very therapeutic, but you know, I see a lot of people that come in the office and, you know, have a lot of depression issues, a lot of anxiety issues. I like to check someone's balance and their coordination. And I find that, I mean, I've even seen, Olympic athletes, having balance issues, and you're like, how in the world is someone at this level? And, but when you're properly testing people out, you can typically find, deficits, and the whole goal is to find deficits and make those things become a strength instead of a weakness.
Right. Right. I think overall, any injury, any, anything that's going on that you're not getting answers, I think the key is to check, is your brain balanced, really? There so much comes to play, what the brain does and how it fires. And I think somebody asked about medications, and I'm going to touch on this really quick, but like for John, we aren't using medications at all to suppress any of the agitation he had. I mean, we took him off all of them and it got better. So, I found with John a lot of paradoxical effects when they did give him. And, with the brain injury, everybody's brain is different, everybody's injury is different, and how, chemicals go in and how the body interacts is so important, and everybody's going to be so different. So one thing that works for somebody as far as a medication is not going to work for everybody. If there was one trick, one pill for, changing all that, I do feel like medication slowed John down, because looking back, at the beginning when he was emerging, he was doing really wonderful, like really showing signs stuff. And then once they started adding medications to try to help him make more gains rather than allow his brain to develop, is when things started going south. So that's just my observation from looking back from where we are now. So that's just my input. So we're pretty much, we've tried every medicine on the spectrum for behavioral, even to the point they tried Nudexa, which is like for somebody that has like a personality, like I think if they cry too much or they laugh too much, you give them Nudexa to make them do so they don't do that. They tried it on John and it just made them even worse, So anyways, if that helps anybody.
Yeah.
So anyways,
my effect is more from the from the rehabilitation standpoint, and again, I don't prescribe meds, so that's not my strength and stuff. What I do is I just check people for, is there any type of dietary recommendation, is there nutrient stuff, and then we have them stay up with their neurologist or whatever, their internal medicine doctor, their GP, their NP, PA. Who deal with all the medications. Fortunately, I'm just glad, because it's just, I like what I do and I'm really good at that.
Well, the cool thing is we're not going down the avenue of medicines, and which is, we're finding that he's healing with the tools of just natural things, foods and supplements and, eye movements and lasers. It's all things that like are not, what is the word I'm looking for? Fake, really. It's just things that can have everywhere. I don't know.
John, what's going on, man?
See, what's up? What's up? He just had a buddy come by and bring some of his gear from the military. What did he bring you? Navy stuff. You guys want to see something cool? Let me get it. He's like kind of gung-ho about this right now.
Navy.
Yeah. Hey, John. I had to work with I had a Navy SEAL come in last week, and it was awesome working with this guy. He was like one of the first Navy SEALs.
Look at him. Look at him. He looks so cute. I gotta show you something though. John, talk to him. Talk to Kyle.
Hey, John, so you had a good Christmas, huh? Laura's been working you out. She's been showing me pictures. Yeah, she's been working you out. I see that. Got you doing sit-ups and trying to crawl.
So I got to show you guys this. So this is one of his book bags he used all the time, and I'm looking through it to see what's in here. And look what I found inside. To my amazing wife.
Oh, look at that.
There's nothing in it, but how cute is that? Yeah. Look at him in his military. How about this? Oh my gosh. Here we go.
Oh.
Our little sailor boy. Oh my gosh. So I hope this really helped people in the sense of knowing that there's answers outside of trying to meditation because, or, you know, losing hope that this is just going to be a lifelong struggle. Because I think a lot of people with brain injuries and the anger issue and the outbursts and the impulses really limit them in so many ways. But you got to realize also it's a part of the process of breaking through. So sometimes I think that you have to allow the individual to go through it to get to the next part.
Yeah, I mean, just again, people just there's a lot of stuff out there. One, you know, diet modifications. I've seen people put, you know, ketogenic diets, paleo diets, FODMAP, AIP diets, food sensitivity elimination diets, Mediterranean diets, gluten-free, dairy-free, sugar-free. I mean, there's a lot of different dietary modifications that you can get on. You know, checking someone doing like an eye movements. The eyes are super important. Making sure no one has, you know, any type of retained primitive reflexes. If you do start doing primitive reflex integration with either OT, PT, you know, a chiro, if he knows how to do that. Yeah, and then just, you know, start working on core stability. And again, if you have patients who, you know, can't do that, they're laying in a hospital bed. Again, start with, you know, looking at primitive reflexes and maybe get with a, you know, nutritionist or a dietitian or a functional medicine doctor to start. Again, you just have to find all these small little X's to try to knock this big X out. And,
Absolutely.
you
And
know,
then,
I just, go ahead.
no, I was just going to say, and also I think, you know, I keep reiterating this in every talk that I do, but it's a process, and like it's overwhelming for, you know, but you also got to just surrender it and know that each piece will fall into place. And also find providers that you trust. Like without you, when you came along, you started answering my questions, but you also guided me that I didn't have to think about every 20 million things that we were trying to get to. I just knew that the process was going to get us there. Just kind of like we wrote out all the goals I had before you came. And then we look at it like 8-10 months later, and we're like, well, those all got taken care of, you know. But it's just that kind of thing of not like continually feeling like the weight of, we got to get through this. Just kind of take each step as you go, and every little step is progress in the right direction.
Absolutely. Well, again, just finding out certain things. So just like, you know, start small, changing diet, removing certain things. And you got to be very careful too. You know, I've seen patients with, you know, even using laundry detergent. There's certain detergents that people can be sensitive to that can create inflammation. And then if they can't get rid of this stuff, they can't detoxify, then that can have an impact. Mm-hmm. You know, and if people can't metabolize certain things, for example, additives in foods, that can make a difference. You know, even the lighting, you know, some people have sensitivities to, you know, different type of lights. You know, as there's typically an answer for a lot of things out there that people are questioning. It's just they don't really know where to search. And I think that's where, you know, we put together a great website. Laura, you know, did an awesome job. So there's a website people can go to that's got a lot of resources. And I just think that, you know, people that are watching this are looking for help, go to that website. There's a lot of resources on there that Laura did a great job with. And the whole goal is just to educate you people, and hopefully that, you know, people start sharing this stuff. And this stuff's real. You know, I've had, you know, when you start doing stuff like this, you're always going to have people like lash out and start trying to chop things down and start trying to say things aren't real. But, you know, I fly all over the world teaching. I get a chance to help people who literally fly from all over the world to come see me. And I'm not bringing this in any egotistical or bragging way. It's just when you get results, you start doing things. And it's always really easy for people to start who don't really see a lot of people and don't see a lot of hard cases can start throwing on their little whatever they want to say. But, you know, I read, you know, my wife knows this stuff, but I read a significant amount. If you came to my house, there's more research papers than, you know, and it's just, I read a lot of books, and I'm, you know, very educated in this stuff. And, you know, it's
passionate.
You have to, you know, it's just, you know, things that happened last year, things can change, and it's just, there's always new research, and it's hard to stay on top, but you got to stay on top if you're going to work with people with, you know, neurological issues.
Yeah. Really quickly about environment, like you said, like laundry detergent for John, we, just for everyone listening, you know, we changed, we took away most everything that was plastic from him. You know, I mean, you can't get away from plastic. It's everywhere. You know, we put an air filtration in the house to make sure he was breathing good air. We, you know, the water system, what's in his water, we started filtrating the whole house, because what was happening is when he was taking a shower, it was making him itch because the what was in the water. And then like this drinking water, we had that filtered through a Berkey. And then as far as like laundry detergents, and then you know, cleaning detergents, like the cleaning in our house, we just try to keep it as clean as possible. You can't run away from it all, but you know, just being aware, those little things can make a big difference.
Absolutely. So,
Yeah. Yeah, we even also put a filtration in our car. We which is really cool. So because when you're driving around, you're inhaling, and he could actually say you could smell like the car fumes sometimes, and so it's filtering all the air that he's breathing in the car.
yeah, well, you know, this was crazy. So someone's talking about anxiety portion. So I had a patient that recently she was actually in here today, and where she was working at. It was, you know, she was having these symptoms. She would go to, oh, sorry about that, but when she would go to work, she started having all these weird symptoms, and then, you know, she was home and going on vacation. I'm sorry. So, good. So,
There we are.
coming to find out, she actually had mold in her air vent. So
Yeah.
there was, you know, and she's breathing these spores, her body's not fighting off. It was making her have panic attacks. Literally, they completely get rid of the mold, and then her, you know, anxiety levels and you know, panic attacks actually start to go down, even go away. And again, what's happening is you're, and you guys went through the same stuff, experiencing, you know, mold, and, you know, just getting rid of all these things, you know, these small X's, they make big impacts on the big X.
Right. People are asking what the website is. It's just staystrongjohnnygrant.com. So staystrongjohnnygrant.com. So just like the hashtag.com. And on there, I've listed, you know, I need to update with some more, you know, products that I've found that have worked, because everyone is going to be different. There for a while, John was sensitive to lemon. Remember after we did the sensitivity test? So there was a lot of products that have lemon in it. So I couldn't use them, even though they're great products. And then he was also allergic to coconut for the longest time. So we couldn't do coconut, but now he can. But I list some of the products I've used on there. Even my crock pot. I got one that can't, it's the clay ones that it can't get the fumes or whatever off the ceramic or anything like that. Yeah. I had that listed on there. I am so crazy, Kyle.
It's good. It's good to educate people. But hey, John, you look like you're ready to. I'm about to give you your wife back, so that way you guys can enjoy the rest of your evening. He's like, yeah. All right. So you guys have a great evening, John. You look great. Merry Christmas.
Thank you, Kyle, for doing this. You have a great rest of your holiday. If you get any time off.
Absolutely. Yeah. Tomorrow's my last day, and I'm going to the woods. So
there you go. Go hibernate.
I am. All right, guys. You have a great evening.
All right. Take care. Say bye.
Bye, John.